right, we're back. Our next guest says sleeping the right way can help you out in a big way. The wrong way can affect your energy level. It can actually add weight. You can put on weight if you don't sleep correctly. We're going to find out how. Yes, please welcome chiropractor Dr. Greg Vanvakaris, who is here. Good to have you with us, doctor.
Very good to be here.
You have a very beautiful assistant helping you out today.
I'm very grateful.
Brooke, if I may, you shared with us last time you were here that you broke your neck in a pool accident.
Yes.
It has affected your sleep, yes?
Of course, yeah.
How so?
I've got a fusion in my C3, 4, and 5, and there are nights when I will, wake up and just be in excruciating pain and not know how or why it happened, but it's just tweaked. I mean, I'm sure the titanium doesn't help.
Yeah, yeah, titanium causes a problem every now and then.
Exactly.
So you're a side sleeper.
But I am a side sleeper. I learned to do that during pregnancy with my daughter. I used to sleep on my stomach, which I know I'm probably going to hear is like the worst thing in the world to do. But I was happily, learning to sleep on my side. But is that good or bad for my neck issues?
For you, actually, side or back are best for your neck issues. Stomach, never, ever again.
Yeah.
Never, yeah.
I can feel it.
But that's for
definitely.
everybody, right? Stomach is a no-no for everyone.
No for anybody.
Right.
Would you know what would be causing her the pain if she is sleeping on side and waking up?
It could be certain position she's in if her pillow is too thick or too thin, so it doesn't stabilize. Because between her space, her ear, and her shoulder, you kind of want that space to be
filled if you're on your
side.
side.
So it keeps you neutral. Yeah,
Oh, perfect. Well, let's
and
get
then,
in.
Yeah, and then depends how much she flip-flops during the night, or if she's only on one side like she was taught in pregnancy.
All right.
Like
well,
the therapeutic pillow, or do you just go with the regular? Is it more about the
that style of therapeutic?
density?
Yeah, that actually works well. Also, like a medium foam style works. What we don't particularly like is having the old school style of feather pillows, because when your head goes on, it feels awesome, but then as time goes on, there's no stability.
There's nothing there
so
whatsoever.
it puts a lot of stress on your spine.
Well, do you mind showing a little bit of how you would lie on your side in bed so he could see?
Oh my God! I was wondering why we were in the bedroom. Okay.
You want to give it a shot?
Here we go. I don't know. At least I wore a nice long dress. How about
Yeah. So, but when you sleep on your
Is
side,
this supposed to be my husband?
yeah, I guess it could.
Would you feel more comfortable if we put the sheet over you?
Yeah, exactly. If I'm crawling in.
Yeah.
No, it's all right here.
But you would.
This is me. Except for I need about 20 more pillows because I'm a cloud sleeper.
Yeah.
And I can't actually show you, but I do the pillow between the knees. That could be a little interesting for on camera. And then I do this. That's it.
And that's how you sleep.
I'm a
All right, so Dr. Greg, what do you see?
Is it?
Yeah, I need a much more
Thicker pillow?
firmer, yes, a much firmer pillow.
What's she doing right? What's she doing wrong?
Well, one, she's sleeping sideways on the bed, so no big.
Difficult in the wardrobe here.
But if she were sleeping normally,
my shoes on, typically.
yeah. But if she were sleeping in the right position on the bed,
Right.
I'm doing pretty
and
good.
if she did do the pillows between her knees, which she won't because of the dress.
Right. That actually, she's actually pretty good, pretty neutral spine. She knew right away that pillow wasn't a good fit for her. So she's obviously had some experience with that discomfort.
Yeah.
Would you use that long pillow to help you? That's a body pillow.
This?
Yes.
Oh yeah.
Yeah.
This is
That's
the
actually
best
great
thing
for.
ever. This is like everything. This is like supports your arm. This has like in between the knees.
And that's what you normally would sleep with, is something like that, or do you have two separate pillows?
I have separate ones, but I hug one. I have one for the knees. I've got one for the back for the flip over.
Right. And what's your husband got like 2 inches of bed to sleep on? What is that? How does that work?
He has his own king. We have two kings. I'm kidding.
Do you have less pain when you sleep that way on the side?
The side seems to be what I have found as the best case scenario.
But no, the only problem you have sleeping on your side, you squish your face, and
I know.
Do we need to worry about that, doctor?
Really fast. Well, my daughter wants to be a dermatologist, so maybe she can help me with that.
It does add a little bit of stress for compression wrinkles.
How can you avoid that?
So the back is better?
Back would be better, yes.
Right.
But if you want to sleep on your side, is there something you can do about, doing that and squishing your face and your eyes? Is there something you can do?
Really difficult because of all the different style pillows there are. And so most people, when they're in that position, the wrinkles are more minimal with sleeping on your side than sleeping face down.
So if she starts on her, you would encourage Brooke to sleep on her back. Is that right?
Yes.
Okay, now you show me.
So. Oh, you're coming back down here. Oh, yeah.
I think you should show us how we sleep on a back.
Down.
Good night, sweet dreams.
I got my shoes on the bed, which I can't do. I can't do that.
Awkward.
So right away, we want to uncross the legs.
Oh, see?
And then what we're going to do is we're going to put a pillow underneath the knees here. And again, this pillow actually works pretty good for it. We'd scoot her down just slightly.
Oh.
There you go. So this is very neutral, less stress on the spine. And
But it hurts
So you
my
want to
hip.
cross your legs,
My-
which
but
is
for my
interesting.
hip, it helps my hip.
To
'Cause
cross your legs?
Yeah, because I have uneven hips. I'm a mess, okay, basically. So, I mean, if I sleep that way, it really helps. Quit laughing, Buck. I heard that.
if that is the case, then if you're going to sleep with your legs crossed, then you need to make sure you incorporate some stretching in your normal life routine. Because
Do
when
you
one
sleep
leg's
with your
always
legs crossed?
crossed,
I
it'll
do.
cause a lot of tension in your low back and your hips on the opposing side.
Okay.
So you want to be mindful of that.
Okay.
For sure. Also, a lot of people sleep with their arms over their head like this. They're
Yeah.
super comfortable.
Yeah.
Worst position on the shoulder girdle. And also, sometimes people wake up in the morning with their hands falling asleep, and they'll shake them out because they've lost some blood flow from having their arms torqued up.
Mary Lou Henner told me that if I sleep with my hand on my tummy and one on my heart, I'll fall asleep right away, and I do.
And actually, that's because the heat's coming from your hands. That's where that
Oh,
comes from. So
yeah.
it's comforting.
Yeah, it is.
Doctor, what about,
Suzanne?
you have this here, you were talking
yeah.
about this earlier. This is for somebody sleeping on their stomach.
Yes.
What happens to the spine when that?
So this is her neutral spine, and what comes out of these little holes right here are the spinal nerves, and you have some arteries that come out of there. These joints back here help move, and you have discs. When we sleep on our stomach, if we were to take this here, what happens is this gets
So this would be our head,
torqued.
this is our face
Yes,
here.
your face would be there, and then the hips get torqued. So you can see what happens to the joints,
hurts just
the
looking at it.
nerves,
Yeah.
and so that's really why it's the most difficult
The biggest
position.
no-no.
The spine, as well as all the muscles, the tendons, ligaments, everything gets compressed, and then typically people sleep on just one side, always faced one way.
Yeah.
And so you start to get a lot of changes in your musculoskeletal system up top, where one side starts to develop more than the other. And one of the easiest ways to see that is when you're driving, you'll notice it's easier to turn to look over one shoulder than the other,
Yep.
those
Yeah.
type of things.
Yep.
And also people at work get headaches a lot more because when they're using their mouse and things of that nature,
Sure.
they already have a lot of tension built up in there.
Can I
and
ask
so,
a question, though, about, you're talking about the pillows, too, but these foam mattresses that are out now that everybody's talking
Yes.
about that conforms to the body, when I use them, I wake up, I'm nearly crippled. I need to have a spring
You're sleeping
in my
on top of
mattress.
them?
No, I'm sleeping on the bottom of them. It's like no, but the spring form ones seem to bother my back. Are
the spring or they?
the ones that are
The memory foam?
Memory foam hurt your
Memory
back.
foam, yes.
Yeah, they also make different levels of intensity with those.
Well,
So you
why
might have
is
something
that?
that's too soft and it's not stabilizing you.
I see.
Just
Oh,
needs to be
they
firmer.
really
Yeah,
hurt, yeah.
just like the spring-loaded one, you wouldn't typically get a soft mattress. You'd get like the medium
I
firm.
get
firm.
firm, really
And
firm.
so they make those memory foam in a firmer condition.
Same
as
thing
well.
with pillow. Can we use a memory foam pillow?
You can use a memory foam pillow.
Is that-
Yes.
Okay.
What about someone, Doctor, like Brooke, who sleeps on her side? You would recommend her back. In that case, how do you begin that transition? How long does it take? Can you train yourself because you're asleep? How do you do that?
Well, for many, many years, a lot of my patients have come in, maybe 40% with neck pain and back pain is because they sleep face down. So I used to tell them to tie a knot in their sweatshirt so if they rolled over, it would wake them up. But
'Cause they're
everybody wants to wear a
uncomfortable,
sweatshirt
yeah.
to bed, and
Yeah,
also
yeah,
it gets
yeah.
really hot. So we developed this called the sleep strap, and what this does is this is gonna wrap around you. You can just put that back on.
This looks like one of those like headlamps that you wear in a cave.
I was saying it reminds me of the Minions.
Okay. So this goes
Despicable
around.
Me.
Yes.
Goes around. You could do that on your forehead.
Like that.
So where should the position
This
be?
looks like
So-
a good little massage ball
Yeah.
hidden in here. That's
goes-
immediately what I
So
want to do.
it goes just under the sternum here.
Okay.
And the way this works is whenever you roll over onto your stomach, it'll cause some discomfort, mild
Yeah.
discomfort.
Oh, that's terrible. That does hurt.
And so it causes you to roll back on your side or on your back. It takes about a month, and you want to train. It's retraining your brain proprioceptively so that you don't keep rolling over.
Right.
First week, it's going to be disturbing because a lot of people start off on their back and they flip at night.
Yeah.
And they don't realize.
They
it.
don't realize they're doing
Right.
it.
That's why I have 16 pillows.
Yes.
You can't flip.
Oh, right.
You can only twist.
So people will wear this every day for a month, and then after that, they'll wear it like once or twice a week for a couple months,
Yeah.
and then every once in a while just to reinforce, like any other training on the body.
Right.
Okay, well, Dr. Greg is giving away a sleep strap to 5 lucky viewers, and just follow us and retweet our tweet with the hashtag #TheSleepStrap. And 5 lucky viewers will be randomly picked, and you'll get one of these.
You're a belly sleeper.
Really
this
cool.
can help you.
By the way, if you'd like to buy one, you can go to thesleepstrap.com. And all the information is on our Home and Family website. You can go to homeandfamilytv.com. We're coming back. We're going to find out a little bit more about our guest today with a fun game called 2 Truths and 1 Lie. And it's next, and I'm not lying.